Welcome to Living Well Naturally. I'm Dr. Saylor, a KST chiropractor and owner of Every Family Chiropractic Center, located in Royal Oak, Michigan. My patients, from 3 hours old to 103 years young, all have one thing in common. They want to feel better. Together we will share and explore a healthy lifestyle to help you be the best you possible. It is my goal to provide you with the insight and information, experience, and motivation that will allow you to feel better and put you on the path to living well naturally. Today we're talking about natural birth options. Joining me today are Dr. Marissa Heisel and Patty Brennan. Dr. Marissa, tell me a little bit about yourself.
Thank you. I'm a holistic chiropractor up in Canada and a Canadian founder with doTERRA Essential Oils. Okay. I'm also trained in midwifery and was a doula for a number of years as well.
Wonderful. Ms. Brennan?
I own a business in Ann Arbor, Michigan called Center for the Childbearing Year, and we offer classes for expectant parents, so we do childbirth preparation, breastfeeding, newborn care classes, and I'm also a doula trainer through DONA International, and so I offer birth and postpartum doula training, and my background is that I've practiced as a doula and a home birth midwife.
Awesome. So just so a lot of people don't really know the difference between a midwife and a doula, so maybe you guys can kind of let us a little bit of insight. First of all, what's your intake on that?
So a midwife is a medical care provider, so they're going to be doing clinical care during the birth. They're really responsible for the well-being of the mom and the baby in terms of how they're going through the labor, and do more clinical tasks like listening to heart tones, or if there's a reason to check dilation during labor, they would perform that type of task, blood pressure, all of that. Where a doula is really there for educational support and emotional support for the mother, and focuses more on comfort measures and also supporting the partner to maybe help the partner to help the woman who's laboring, and so
Okay.
So it's a really non-clinical role. That's the big difference.
And I think we forget about the partner needing that support too. So yes, we have to, takes two, usually.
Yes, I was smiling as you were saying that. Yeah, most definitely. I've been in labor rooms where the partner can be very anxious. It's very difficult to watch partners watch a woman in labor if she's in pain. Yeah. Maybe particularly so for men, but not always.
Okay.
And so sometimes that's really has to be the focus, is to give somebody a task that they can help with instead of just sitting in the corner or trying to flee the room, and I've seen both.
Yes. I have a friend that her story is her husband ate Cheetos through the whole thing, and all she heard was the crunching of Cheetos.
Oh my.
And I was like, okay, not the best story.
How did that work out for
Exactly.
her?
Not so great.
Yeah.
So we're going to define a little bit about natural birth. And so what's your definition? I know it's a wide, broad range.
It's huge, truthfully. I think even more than defining natural birth, for me, birth is really about helping to support a woman to have the kind of birth that she's looking for.
Okay.
You know, one of the things, and I was saying even just before, one of the best things I learned in midwifery was setting aside my strongly held beliefs, because for myself, I wanted home births. Not every woman is going to. I had a patient who said to me once, "It's fantastic that you're in midwifery. If I could walk into a hospital backwards and have an epidural walking in the door," you know? And for her, that would have been the perfect birth. I wouldn't have been the perfect support provider. But a natural birth is really something that allows a woman to feel as though she has been listened to, that her desires have been acknowledged. And sometimes that ends up in something that's surgical. But my biggest imperative is really to help support a woman in what she is looking for.
Wonderful. And what about you, Ms. Brennan?
Well, I totally agree about keeping the birthing mother at the center of this experience, and all of our support should be around that and around her. But if we're going to really define natural birth, I would say I think you're thinking about something that is not overly medicalized, where there's not a lot of medical interventions during the birth process, where the mother has freedom of movement, so she can adapt her response to her labor, and also the movement will help her with pain relief, so she might be less likely to feel like she needs to request drug relief for pain. So she has more ways to kind of adapt to it. And freedom of movement, and also just not being tethered. So if she's got IVs that, and monitors and other things that are where she's confined to bed, I mean, you can still have a vaginal birth, and it doesn't necessarily mean you're having a surgical delivery, but you're kind of getting further away from what would be technically natural.
Because like we've talked earlier, it's like there's nothing really natural about laying down in a bed.
No.
In a horizontal position. It's just, that's not how we've been, as women, we've been having babies for quite a long time. And naturally, it's using gravity and using, I think it's changed a lot though, the medical interventions.
Unfortunately, the medical interventions have really gone in the direction of what's most comfortable for the attending physician to the position that's most comfortable for them to deliver in, as opposed to what is most conducive for the woman in order to give birth in the most optimal position. And so there's that uncertainty or that little bit of discomfort there. Okay. There are a lot of positions a woman can give birth in, and it doesn't always come to fruition in that sense. The very first birth that I ever attended was supposed to be a home water birth, and ended up being a surgical birth because it truly was what the baby needed at the time. But I think what's important in that sort of situation is to allow the woman to still feel as though she has a voice and she's being listened to and she's being empowered and these days there is a very small movement towards surgical births that are still something that the woman can feel that she's walking away from with her head held high and that nothing happened to her. Right. Which is a little bit different.
So important, because when you're confined to bed and you're tethered there,
yes.
It's really hard to not have the experience be something that is happening to you, and that's a lot scarier because it's somewhat like you're a victim of your birth, and everything that's happening is sort of out of your control, and you can't even really choose how you're responding to it because you're just lying in the bed. But for when women can kind of get up and move around and have good support people and even allow themselves to think like, how am I going to respond to this contraction? Maybe I'd like to get into the shower now. Maybe I'd like to go do this.
Wonderful.
Moving around is awesome.
Okay. We recently spoke with Valerie Weiss, who has delivered in a birthing center, and she plans to deliver again in the same birthing center very soon. And she's also an amazing birthing photographer. So let's hear her story.
So my firstborn, Ava, she's 4.5 now. She was born at the Alternative Birth Care Unit, which is a part of Providence Hospital in Southfield. When we first got pregnant with her, I figured I would go the kind of traditional route and go the hospital, Beaumont. I had an OB/GYN through Beaumont. And when I started to do more research around pregnancy and childbirth, I just started to see kind of the trends with the C-section rates being really high and Pitocin use, and it just felt very medical. And when we took the birthing class, I started to notice that we were the only couple that was going through a traditional hospital system. Everyone had midwives. And the more I looked into it and looked at the philosophy and the approach to midwifery care, I was really wanting to switch. And I was actually 30 weeks pregnant. The birthing options with working with a midwife, it's like working with a master's level trained, certified nurse midwife. And if something more significant is going on, there's OB/GYN backup and care and support if needed. So it's a really collaborative approach to reproductive health and care. The personalization of the care is what sold us on choosing that route. The more default approach that's been established in hospital settings, looking at birth as a medical experience. And I think it's a natural experience. So the idea of wanting to have a natural birth, I didn't feel like I could do it in a hospital setting. When my daughter came out and she was calm and she didn't cry and she just looked around, half the reason I did that was for her. Having the midwifery care that if it doesn't go according to plan or if we have any complications, I trust the decision making of those around me, and I don't think it's for everyone. I had my reasons for doing it. I have my reasons for doing it again. I just encourage people to be very mindful of what their options are for labor and delivery.
Okay, so there are options, and the photos were beautiful, by the way. I always wanted to have photos, and then I was like, oh, I don't know if I should. So
I love birth photos.
I know, they're just gorgeous.
I think a few points in there were really salient. One that I love about midwifery care, is that even through pregnancy, instead of just being presented with, here's a test we're going to do, women are presented with, here are the reasons that we do this test. Here are the pros, here are the cons. Here's the information that we get from them. And women have choice. They have decision making all the way through their pregnancy. And there's a greater fluidity in order to encompass every different woman's own personal philosophy about birth and about medical care. I love that about midwifery care, as opposed to we're going to go do this and here's why. In fact, there's no explanation generally of here's why. It's just this is. So that's one of the things that she did comment on, and I really do appreciate that aspect of midwifery care.
And I think that's one of the strengths of the doula as well, so that if a woman is not working with a midwife, or where those kinds of choices are being presented to her, and her full range of options for her birth and what she would like and how she'd like things after maybe having the baby skin to skin immediately after birth, and breastfeeding without any interference from medical staff and things like that, and just having a very more natural experience, and the doula can really help her to advocate for herself to be successful with that. It isn't that we impose on her our way of doing it, or that there's only one right way to have the baby, but if she has that value of having a natural experience, then the doula will help her be successful with it and help her know what her choices are.
See, and that's what I think is that support. As a woman, we all need support, and then I think there's so many options and choices, and your hormones are just raging anyway, that we need to have someone that can say, okay, this is the reason behind it, and this is why I would suggest this, or making those choices, because you don't know. There's so much. But classes, like you mentioned.
Yeah, birth classes can also basically teach that mindset of really looking at different things that might be suggested during the birth in terms of medical intervention, what the benefits are, how that can help the mom or the baby, what the risks might be, the downside of some of those interventions, and what we might do to maybe offset the downside of it. And then really also alternatives, like, are there any other choices? Is there anything else that we could do to address this problem or this issue that we haven't tried? And a lot of times that's where the natural stuff, the natural approaches come in. And it could be all kinds of things like chiropractic or essential oils, or, just the realm of the doula might be changing position or doing certain positional things that we know can be corrective if the baby's in an awkward position, for example, during the birth process.
But you had asked about Webster's technique, that is traditional, like a chiropractic tradition to turning breech babies. And we've had a huge success rate, and I know you have too, with breech babies turning, if you catch it early enough, and if there's a reason why the baby is not turning back. So, like, my story was there was just one baby that every time I would turn her, she would flip right back. And it was because of a short cord. And so we have to trust the body's wisdom to know there's a reason why this baby does not want to be born in a natural position either.
But I think there's a really important point here that Ms. Brennan was just saying, and that is that, with doula care or midwifery care, I think we see every woman as an individual. Much more so than perhaps we would in a more medicalized system or a medicalized approach to birth, where it's just sort of one after another, and you trod through the obstetrician or the obstetrician's office. And with midwifery or with doula care, there is more explanation. There is more taking into account somebody's individual philosophy and desire around birth, which is very valid.
It's more relationship based.
Yes, certainly.
It's like having a really good friend too, like a good support system too.
It's having a constant, somebody who will be there with you throughout, which I think is important.
And that's being lost in the more standard approach now. And in fact, it's going in the opposite direction, where OBs are practicing in really, I used to think like 6 OBs rotating call was a large practice. And now you're hearing 10, 12, 20, or the whole staff. The whole OB staff at the hospital just rotates call. So the woman is maybe seeing one person for prenatal care, but that's not necessarily, she's got potluck of 12 to 20 people who might actually be the person that is at her birth.
Which is like the most important point for a pregnant mom, is that one person.
Right. They think they're choosing their care provider on the basis of, I really like my doctor, and they may not really see that whole picture. Midwives tend to work in smaller practices, and there's a little bit more continuity of care there. And then the doula can also sort of fill in that gap, because it's a person you have a pre-existing relationship with. You see that person prenatally. She's there for you throughout the whole birth process and also afterwards. So she's got all the pieces of your story and she knows, she understands emotionally maybe what some of your challenges are, and can speak to all of that, which is really important.
I think one of the most important parts of a doula too is the aftercare. So as a woman that you have a brand new baby and you know, everything what to expect when you were expecting just goes out the window and you don't know what you're doing, you know.
I think we have strong thoughts on that book.
Yeah, exactly. Yeah. I know your thoughts on that book. But it's pretty funny because it's like you think like that's when you actually need even more support.
Well,
and it's really hard.
Not every prenatal doula is a postpartum doula. So there is that distinction, that distinction that needs to be made as well.
Okay.
That there are generally women who are prenatal doulas who will be with the woman prenatally and through labor. And usually there is somebody who's trained as a postpartum doula who might do more of the visits to the house, helping overnight, those kinds of things. And sometimes people cross both roles. Yeah. In Canada, at least, and I don't know if it's the same way here, midwives also offer 6 weeks of aftercare. So there continues to be that continuity. No.
That would be nice.
All right, so there are 6 weeks of aftercare where the midwives actually come to your home for the first number of visits, and also take care of mom and baby.
Okay.
I would say in the U.S. there could be a 6-week period that would be where the mom would still be able to call if she had any concerns or that kind of thing. There would not be home visits.
Okay.
And usually there would be one visit at 6 weeks to kind of like, okay, yes, everything. we're all good here.
Baby's good, everybody's good.
Yeah, okay.
Yeah.
So I think that's an interesting, I think that's a whole, I like the 6 weeks of post-care. So, okay, so we have to take a break and we're going to be right back with this short message.
Hey everybody! Heart disease affects 1 in every 3 women in America, but you can fight back. There's no time to lose. Mothers, sisters, daughters, families, and friends, it's time to shout louder, stand stronger, and demand change. Let's go!
To the Batmobile! Dang it.
To the invisible jet!
Dang it.
Together, we can put an end to heart disease. It's time to go red for women. I could use your help. Yeah! Learn more from the American Heart Association at www.goredforwomen.org.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
So welcome back. I'm here with Dr. Marissa Heisel and Patty Brennan, and we're talking about birthing options. What are some of the current trends that we're seeing? And I know they're not quite so current, but we were laughing earlier, like we've heard of all these and we've done a lot of them, you know, we've been there, but a lot of people don't know. One of the things that I loved was hypnobirthing. And I think it was a fabulous, not just for the pregnancy, it was for the 6 weeks leading up to pregnancy. I had an amazing, I would be able to go to sleep with it. I would be able to meditate at lunch, and I loved it. So what are some other thoughts and trends?
Water birth is pretty popular, and the reason for it is because it's the best non-drug pain relief we have is to immerse the mom in water. But I think there's some misunderstanding maybe where people think that it's necessary to actually give birth in the water, where some women are having the baby in the water, and some practitioners are comfortable attending women with that choice. But really anybody, I mean, I think it's a great choice to, if you're looking at a facility for the pregnant moms out there, to see, do they have the option of immersion in water, and do they do water births in that setting, because it's just really excellent pain relief. So
That's nice. What other options for pain relief? I know we have some suggestions. Obviously, chiropractic for us makes a huge difference.
Yes, and as a chiropractor or as a doula, teaching the partner to do things like counter pressure on the hips or pressure on the sacrum during labor, things like birth balls, which are just large physio balls, large gym balls, are fantastic for a woman to sit on, other than when she's pushing, obviously, because they put her pelvis in a different position. They allow her to sink into the ball when she's having a contraction, and it might just be more comfortable to be in that position than to be squatting or lying down. Again, when she's not tethered, if she's not wearing a monitor, that's another nice option as well.
Okay.
Just pain coping, rhythmic movement helps a lot, and I think that's one of the reasons the birth ball is so lovely, because it encourages the rhythmic movement. I guess I want to throw in that even if you do have an IV, let's say, because so many women are going to find themselves in that situation with IV fluids or monitors, it doesn't mean that you can't do some upright positions or you couldn't put a birth ball up on the bed and do movement as well. So I don't want to give the impression that people it's an all or nothing set of choices.
So there's still movement available.
Yeah.
And the reality is that women have given birth for eons, not lying down in a bed. And so anything that we can do to facilitate movement and changes of position is going to be far more beneficial than just being on your back or on your side for what could be hours on end.
Okay. One of the things I know there's a lot of essential oils that you could have in the birthing room, because you do a very specific thing with just pregnancy, right? Any suggestions?
In terms of specific essential oils, I might not go into that right now, but I think what is beneficial to know is that you can use essential oils, and certainly you can train doulas, and I train midwives right now to use them through labor for physical support, for pain, potentially even things for helping a baby to move if you need to, for speeding up labor and enhancing the strength of contractions, but also just as importantly for emotional support during labor. Because there's a time, if a woman is not having a medicated birth, where through transition she can become very anxious or frightened. And so using essential oils at that point to help emotionally, especially if somebody's more prone to anxiousness, could be very beneficial to mom. And so you can diffuse them or put them on topically, but offering that and training whoever the provider is in the room, whether a doula or a midwife or even the partner, to be able to offer even just a few different options are things that could be very beneficial.
Which was really nice. As a chiropractor, we have a lot of patients. I have a lot of patients actually come in on the way to the hospital, and they'll get adjusted the last time. I've adjusted, my sister-in-law right before she delivered her babies. We do a lot of support that way too. And I'm a very different type of chiropractic. I use KST, and I know you do too, and it supports them emotionally. And so we had this whole conversation earlier about it, because it's there's that fear surrounding birth. There's a lot of things that emotionally can be affected. And with doing cranial work, it makes a huge difference with calming the moms down, calming the spouse down. When they're high strung, we can actually adjust them to help them too, which is really nice.
Yeah, because everybody in the room, especially the birthing mom, is going to imprint on the emotions of the people around her.
Yes.
So she's very open at that time and vulnerable. And so you want to be sort of surrounded by people who are calm and have a positive attitude about birth and have a positive expectation and believe in your strength and all of that. So that helps.
Okay. I know we had talked about some other interesting things. We get a lot of questions about placenta encapsulation. That was one of the things that I've been hearing more and more about. Do you have any advice on either? You have an advice on that?
Placenta encapsulation is definitely something that's becoming more popular over time. It's the drying of the placenta and then grinding it and putting it into capsules for a woman to ingest after a baby's born, in the belief that it helps with speeding up healing afterwards and returning iron levels to optimal. And
postpartum depression is the number one thing they're talking about right now.
It does some hormone replacement. So the placenta is very rich in hormones. So there's some evidence that will alleviate symptoms of postpartum depression. Might be something to look into.
And that's an actual training process that some women go through in order to become encapsulators. So you just want to make sure if that's something that you're looking for, that you find somebody who is trained and qualified to be doing that.
Okay. They'll go and pick up the placenta at the hospital or wherever the mom had the baby. They get notified and they'll pick it up and have it ready for her within a day.
Okay. So what other top tips would you do to help support a healthy pregnancy and natural delivery? Do you have any top tips?
Well, one thing that I really loved to help teach women was to have some sort of a mantra or something that when the going might get tough, that she could say to herself. Because at some point, a lot of women, again, when they're not medicated, will say, I can't do this. And something to replace I can't do this with I can do this. I trust my body, I trust my baby, something that a woman can say if it feels like she's struggling. That would be one thing. And having somebody else in the room, whether it's a doula or whether it's the partner, who can take a woman's hand and look her straight in the eyes and keep her grounded when she feels like things are really challenging at the time. So helping to limit that anxiety if it comes up again can be very, very helpful.
Yeah, I agree. Anything that helps the mom relax. We know just all this talk about fear and the emotions, it's not just fluff. It turns into physiological issues. When you have fear, you've got stress hormones that actually compete with all the hormones that normally help support the normal progress of labor. So anything that keeps the mom in feeling safe, and maybe asking that question to her, what would it take for you to feel safe at your birth? And then make sure that she sets herself up for success and help her explore that if you're a support person, so that she gets her needs met. And that's when she'll have the best possible birth, whether it doesn't have to be natural for it to meet that that requirement.
Right. And we all talk about like the birth plan. You hear some people, my birth plan, I'll admit, was a little long at the beginning, and then it's shortened because it's like the universe knows best, and so you can plan as much as you can possibly plan, but also expect the unexpected sometimes too, because nature and it's an amazing infinite wisdom, and the babies are really smart too. So sometimes they have their other options.
I've taken to encouraging moms to maybe think of it in terms of birth preferences instead of a birth plan.
Yeah.
Yeah, agreed.
Yeah.
Birth options,
Birth
choices.
options, yes. And what would it take again to allow you to feel successful and walk away at the end feeling successful, no matter what, no matter how the birth ends up going, But the belief system used to be that as long as you have a healthy baby, and that's not actually true. If a woman walks, yes, we all want a healthy baby, but if a woman walks away feeling as though she was completely disempowered in that process, or again, that things were done to her and leaves with a sense of victimization, then for that woman, the only thing that matters is not just the baby, but also her sense of self going forward into mothering. We want women to have a sense of success as they move forward into this new phase of their lives.
Right. Okay. And we're seeing an increase of women who feel that they've been traumatized by the birth process, and that's how they're starting their mothering journey. And so it's sad. It's very sad, and I'm all about trying to prevent that.
Yeah, exactly.
And ending on a note of success, allowing a woman to recognize that maybe things didn't go the way that she would have preferred, but she ends with a feeling of success.
Right.
That would be something I'd love to leave women with.
That's how, for me, my birth didn't go the way I wanted it, obviously, but I look at it like there was a reason behind everything that happened, and it's amazing, and I have this beautiful daughter from it, but also accepting it that it wasn't exactly the way I wanted it, and I was okay with it too. So, okay, so I'd like to thank my guests for joining me today, and I hope that we've been able to inspire you with new ideas and suggestions. I encourage you to do some more research. Whether you find information on the internet or at your local bookstore, it's worth your time. My goal on the show is to provide you with the insight, information, experience, and motivation that will allow you to feel better and put you on the path to living well naturally. I'm Dr. Anna Saylor. Come and check me out in person and check out KST for yourself at Van Every Family Chiropractic in Royal Oak on Saturday, May 16th for our annual Kids Day event, which is from 10 to 1. Thank you for watching.